Good morning, everybody in Elaine's English and Communications class in Selbridge Community School. I'm sorry I couldn't be with you guys this morning. I had hoped to meet you in school, but here we are. My name is Mark Moore. I'm a co-founder and the CEO of Toothpic. We're a teledentistry company, which means we make software for patients to get a checkup from a dentist using their smartphone. We have a mobile app called Toothpic that you can use to take photos of your teeth, send them into our system, and a dentist will look at them and give you a checkup without going into the dental surgery. So that's what I do, and I'm here to give you a bit of background on how I started the company, what we do today, and our plans for the future. And hopefully that will help you guys with your Leaving Cert Applied assignment. So thanks to Elaine for inviting me to do this with you. I'll start off with a little bit of background about me. Um, when I started my first business, I was 8 years old. I was on my mum's family farm, and they had these pieces of wood that were left over from the farming work, and I took those home, started painting them, taking them into the local market in Limerick, and selling them as door stoppers. I sold them for about 20p each, and I realized that people really wanted to buy. Were happy to give 20 pence to a small kid who was starting out in business, and so I was able to sell them very easily. So I went home and I started to employ some of my friends over the summertime. I was paying them 20 pence per hour, and then I would take what they'd painted and each Saturday take them to the market and sell them, which I made about £2,000 from at the time, which made me a very rich 8 and 9 year old. But at that point, I got hooked on business and figuring out problems that I could solve and get paid for. And so ever since then, I've pretty much been running businesses throughout school and college. So later in school, when I was probably around your age, I was fixing phones. This is before iPhones and Androids. I was fixing old Nokias and fixing screens, and getting paid for that. And then later, when I went to college, I did a few different things. I had a chocolate fountain, which I would rent out, a pretty large chocolate fountain. Also bought a candy floss machine, and I would rent that out. I also bought out of date chocolate and sold it to societies and clubs for students that were coming in to entice them to join. And I also bought a silent disco headset set up from China with a couple of friends. We bought about 300 silent disco headphones and rented those out to people in college as well. So I've been kind of doing this for a while. Like I said, I've been kind of hooked on it. But when I got out of college, I started to get into business a little more seriously. I worked with a friend of mine to start a real-time deals company. So we built a mobile app that local businesses around Dublin could put their deals up, and they would be seen by students in our college and in other colleges. And they could go into those businesses and get a discount for products, coffees, lunches, drinks, and things like that. So I was building that app, and one day or one evening, I had a problem with my gums. They were getting kind of sore. I didn't know what it was, and I had a kind of gap developing in my gum. My dad is a dentist in Limerick, and rather than going down to Limerick to see him to ask him about this, I just called him on the phone and said, "Dad, is there anything I can do about this problem?" He said, "Mark, I don't really know what it is. I haven't seen it, but if you take a picture and send it to me, maybe I can tell you something about it." So I took a photo using my smartphone, sent it on to him. He called me back and he said, "Mark, you have this dental problem called a gingival cleft. It means that when I got my braces, the orthodontist, he pushed my teeth too far forward, and I just brushed it too hard, and I brushed away my gum, basically." So this is a problem that my dad said, "Look, I'm not going to be able to do something for you, but if you improve your brushing, you can stop it from getting any worse, and you don't have to get expensive treatment." So that was pretty cool for me because I didn't have to go back to Limerick to find that out, and I didn't have to go and pay a dentist in Dublin to tell me. But for my dad, it was even more interesting because he was able to tell me all this information without even seeing me. And he said, "Look, Mark, if you can do that with your smartphone, I could do that for anybody who sends me a photo on their smartphone." And I thought that was a pretty cool idea. And I was telling a couple of friends about this, and they also thought it was pretty interesting. And they asked if they could send photos to my dad to have him look at them. So he said he'd be willing to look at those photos. So we tried it out. We took some more photos. We sent them on to him, and he was able to tell my friends interesting things about their teeth and gums and stuff they could do without going into their dentist as well. So at that point, we kind of validated that there was interest from patients, and also that it was possible to do. So I guess that was kind of our eureka moment where we figured out, okay, well, this is definitely something we could do, but at that point, we didn't know if it was possible to build a business. Could we build a business that made revenue, that was profitable, that we could grow? We didn't know the answer to that at that point. So basically, we did some research. We weren't even sure if it was legal. So the first thing we did was we went to Google. We Googled around. We figured out that this thing was called teledentistry, like televisions where you could do things remotely. And in the US, in America, they had started this thing called telemedicine a few years earlier. So people were starting to do basically Skype calls with doctors, but nobody was doing it for dentistry. The only thing that existed was a patent from the US military from many years earlier in the 90s, where they had this idea that they could send information between dentists and patients. So basically, in terms of research, we Googled around, we found this patent, and we also spoke to some experts. So basically, we went to the dental hospital in Dublin, where my dad knew some people, and dentists and lecturers and professors in this area, and we basically asked them, look, what do you think of this? Is it possible? Could you see how it would work? What problems would you see with it? And we got a lot of feedback from those experts. We also went to some legal folks. We went to solicitors in a law firm in Dublin and asked them, what are the legal challenges that we might face if we try to do this? And really, they said, this is totally new. Nobody has done it before in Ireland. Nobody has actually ever done this properly anywhere in the world. So they were very conservative. They didn't really want to take any risks, but we were starting a new business and we were happy to take some risks. So the lawyers told us to just take it very simply, work with the hospitals, and don't really go directly to customers. So we took that advice for about 2 weeks, and then we said, look, let's just build an app, put it out there, and see what happens. So we did that because we had some experience building apps from our previous business. And when we put it out there, people started using it. So people in Ireland used it, people in the UK, but people all over the world started taking photos of their teeth and sending them to my dad in Limerick as a dentist to look at and give them feedback. So patients from 68 or 70 countries around the world were sending photos to my dad in Limerick, and he was able to give them advice. So at that point, we decided, okay, we can probably start a company around this. We still don't know who's going to be the customer, who's going to pay us, how much money this could make, if it could even be a viable business. But we said, we have some money, we can invest it in this, and let's try it out. So at that point, we formed the company. So it would have been probably April 2012, four co-founders, myself, my dad, a technical co-founder, and a business co-founder, set about forming this company. So we paid the fees to the company's registration office, we filled out the forms, and we had to get our signatures witnessed. So we went to a solicitor who signed to say that we were who we said we were, looking at our passports and stuff like that. So we submitted the forms, and a few days later, I think 4 or 5 days later, we were received confirmation that our company was formed officially. But like I said, we had already started validating to make sure that there was actually a business there, or potentially a business there, before we set up the company officially. So once we'd set up the company, we built out this first version of the product beyond what it had just been for people to send photos to my dad. We built out the app with more detail. And one kind of interesting thing that happened to us at that time was when we put it out there, a TV company from the UK got in touch with us and asked if we'd be willing to be featured on a television program, which I'll actually include the link to for Elaine to show you guys afterwards. But once we put that out there, thousands of patients all over the UK were watching this TV show called The Gadget Show, and we were featured as a health app that could help people to get checkups at home. So thousands of people took photos of their teeth and sent them in and showed them to my dad, and he gave them a response from Limerick. And so at that point, we realized, okay, there's something here for patients that they like it. Many of them wanted to know, could they get whitening? Were they suitable for Invisalign or getting their teeth straightened? And some of them wanted to know, what was the general health of their teeth? And overall, general health was pretty good. People probably could have brushed a bit better. And my dad was able to give them very specific advice on an individual basis. So once we had this kind of validation that there were thousands of people who were willing to take these photos and submit them, we decided, okay, this has the opportunity to be very big, and it also has the opportunity to be a global company. So some businesses that start off very local, they might try to be profitable immediately. They might try to make money immediately. We wanted to make money, but we didn't really know how. So instead, we decided we would try to raise some investment from other people. So the first people we took money from were ourselves. So myself and my other co-founders, we didn't take a wage like you would get if you worked in a regular company or an established company. We each took no salaries or later reduced salaries, and then also we invested some of our own cash, some of our own money. My dad also invested as effectively our first angel investor. So he invested and he got shares in the company for that investment. We then started to go to other investors. So I flew out to San Francisco to meet investors out there. And we were reasonably successful, though it took a long time and it was a lot harder than we expected. Um, in partner, we got a couple of individual investors to give us about 150,000 euros. Two people gave us 50,000. Well, really, three people gave us 50,000 each. And then Enterprise Ireland approved us for funding, and the Enterprise Ireland money matched the private money. So Enterprise Ireland gave us 150,000 euro, and these private investors gave us a total of 150,000 euro. So we then had 300,000 euro from Enterprise Ireland and private investors, as well as about 100,000 euro of our own money to run this business. So we started to increase our reach and started working with some more companies. We did some pilots. We were able to work with Alea Healthcare, the insurance company in Cork, and we started then reaching out to companies in the US who might be customers. So initially we reached out to dentists, but also to insurance companies. And a couple of insurance companies got back to us and said they'd be interested in using the product and giving it out to their members, to people who have insurance with them, who have dental insurance. So that worked very well, and we had thousands of people who used the platform through that process. And then we realized, okay, well, again, if we're going to make this bigger, if we're going to improve the product, we're going to hire more people, we're going to need more money. So we weren't profitable at this stage. So we couldn't grow the company based on our own profits. So we had to get this money from somewhere else. So as part of the work I was doing in San Francisco, trying to raise more financing, I met some people who were able to introduce me to Philips, the global company based out of the Netherlands, who own a big toothbrush manufacturer in the US called Sonicare. Philips Sonicare, they make these electric toothbrushes, and so they were very interested in getting into software because they have these hardware toothbrushes that are Bluetooth connected and they track. They're expensive, like $50 to $200, but they track how often you brush your teeth, how well you do it, and if you miss certain areas, they alert you to that. But they really wanted to get into software because software is exciting. We can make changes to software a lot faster than they can in terms of their brushes, and also they thought they could make more money selling software to people who already use their toothbrushes. These people, some of them paid $200 for a toothbrush. They figured they could sell them a service through software. So Philips were very excited about what we were doing, and so we negotiated a funding round with them, where Philips gave us about 2 million euros, and Enterprise Ireland gave us another 200,000 euros. So we raised a total of 2.2 million euros from Philips and Enterprise Ireland. And that was effectively our seed round, which is financing that tech companies often talk about to get started and to really flesh out your product and hire your main team. So at that point, when we raised the money from Philips and Enterprise Ireland, we were about 5 people. We then took using that money from Philips and Enterprise Ireland in our seed round, we grew the team. So we grew from about 5 to approximately 15 people. So we hired more engineers, some software engineers to build better mobile apps for Android and iOS. We hired a back-end developer, front-end engineer, some quality assurance people, and then also some marketing people, customer support, and general kind of business people. So at that point, we were about 15 people. Um, we then also needed to improve our processes and our quality control. So we started to invest in building things to regulations. So there are regulations that control how you build software that is used in the medical area. So we ended up working with a consultant, an external guy who'd done this before, and he gave us basically a structure to follow. And when we followed that structure in terms of how to build our software, how to build our teams, how to manage our company, we were able to achieve a thing called ISO 9001, which is basically a standard for how you run a process. And that meant that we could take that stamp of approval. And when we were working with other companies, if they say, how well do you run your business and how well do you build your products in particular, we can show them this stamp of approval from an external agency that says we follow a process, and if we make mistakes, we track them, we fix them, and basically here's how the process works. So we use that money from Philips to, like I said, hire people, improve our process to meet these regulatory standards, and also to recruit dentists. So the other part of our business, in addition to the software that you or a consumer or a patient might use, is that dentists have to be able to look at those photos and give you a report, give you a consult. So we had about 30 dentists when we did our deal with Philips, but they said to us, we really need many more dentists. If they want to put this out, if they're going to market this product for us, they need hundreds of dentists who can respond to patients quickly. They don't want patients waiting around to get a checkup. So we took that money from Philips and we recruited about 250 dentists in the US. So we reached out to them. We told them what we were doing. They were very interested because we were going to pay them to look at these photos. They signed up to the platform, and we paid them we did a contract with them, and then we would pay them every time a patient submitted photos to them, and they would respond to the patient. Uh, and I suppose throughout all this process, we had this money from our investors. We were doing all the things that we needed to do with that money, but at the same time, we were also trying to figure out how do we get as many patients as possible to use it, and also how are we going to reach these patients. So we were going through a process called finding product market fit. So we had a product, there was a market out there somewhere. We were trying to figure out how do we change our product to meet this market. And so either we find the right market, or we change our product bit by bit so that it fits with our market. So we were always talking to new customers, asking them what the problems were, asking them if our product solved their problems. And if it didn't, we were figuring out how could we improve the product. So maybe we would, for example, when we started, we just had an iPhone app. And lots of our customers said, well, that their members, that the people who have dental insurance have Androids, so we needed to have an Android app. So that was an example of us changing the product a little bit to meet what our market needed. So over time, we were trying to get closer and closer to this fit of product and market, basically, to make sure that people would pay us and continue to pay us, and eventually that we would be profitable. So that was an ongoing process. We tried selling to dentists, we tried selling to insurance companies, and eventually Philips, who are an investor, also became a big customer. So they pay us on a monthly basis. They get to use our software, and also we give them an exclusivity so that we can't work with their competitors. So for them, they were able to basically lock in the rights to our software, and also they could test things and make money from their users by selling them our platform. So we integrated our platform with the Philips platform. So people who use the Philips toothbrushes could now get a checkup or a consult from Toothpic. So that was kind of our Philips were our first big customer, and really that showed us what type of product did we need in order to get paid, and to get paid consistently over time. So when we had that information, we then started to look at other people who looked like Philips, people who were companies of that size, who were in the dental industry, who might pay us for the software. And so when we started out, we thought we were going to be a direct to consumer company, that we would sell, we would put our app out there, people would use it, people would pay for checkups, and then that we would pay the dentist and we would take our margin and we would get paid in the middle. And that we would scale to maybe millions of customers, and that's how we would make money. But what we realized was, uh, particularly in America, patients don't pay for a lot of patients don't pay for their dental care directly because they have insurance. So they expect that their insurance company will pay for all dental services for them. So we realized, okay, we need to get insurance companies to pay for this because patients aren't going to pay for it. So our whole customer, our idea of our customer, which was a patient, totally changed to insurance companies need to be our customer. Patients will still be the user, but insurance companies are going to be the customer. So we at that point went to conferences, started meeting people from insurance companies, asking Philips if they knew anybody, and eventually we got into these insurance companies, um, and started to build relationships with people there. And over time, they realized that we could help them, and we started asking them more and more about their problems. And we figured out, okay, there's a customer here that wants to buy the product. So in December last year, 2019, we signed a contract with the largest dental insurance company in the world, a company called Delta Dental of California. They have about 34 million people that they provide dental insurance to. And so our contract there was to work with Delta Dental to figure out the exact product that they want to deploy to their members, starting with the Toothpick platform as it is. So they are deploying to about 100,000 people at the moment. And basically, we'll measure how many of those are using the platform, how frequently they're getting their checkups, what their satisfaction is with their checkups, and if they have any feedback on how to improve it. So once we signed with Delta Dental, a number of other insurance companies became much more interested because they compete with Delta Dental in the market, and so they wanted a product like ours. And so from there, we started contracting discussions with other very large insurance companies, and that has basically become the core of the business. So our customer now is insurance companies in the United States, and that's where we sell. So we also realize that other parts of our business aren't as important. Like, we're not going to do the marketing to these patients necessarily at this point. The insurance companies are going to do the marketing, so we didn't need as much marketing in our company, but we did need a lot of engineering, and we did need people who could do sales to insurance companies and contracting with insurance companies. So that's kind of the I suppose the where we're at today. We are on track to be the leader in the US market. So we're pretty much the only company selling a product like this to insurance companies. So we think that we have the opportunity to reach millions of members, hopefully 50 million members before the end of this year. So what that means is 50 million people would have their insurance company willing to pay for a service like Toothpick by the end of 2020. And that's our goal. In terms of profit, we're not profitable yet. We haven't, some months we make a profit, but ultimately we're not consistently profitable. But our plan is to be profitable by June of this year, so June 2020. And at that point, we'll look to open up in new markets. So we're currently only focused on the US, but in partnership with Philips, we expect to open up services in Germany and the German-speaking region of Europe, as well as the UK and Ireland, and potentially other markets. But that will be the focus at the end of this year. Um, in terms of, I suppose, other interesting parts of the business, I said we grew from 5 to 15 people. What we learned was it's quite difficult as first time entrepreneurs and first time business people to manage a large group of people when we haven't done that before. So we had to learn to become managers, and sometimes that was quite tough. Um, and so while we were up to 50, I think at our peak we were 18 or 19 people in the middle of last year. But when we learned that we didn't need all of these functions, we basically had to let some of these people go, which is quite difficult because some of them were our friends, and we'd developed the business with them. We'd know them for a long time. So that was kind of a big learning curve for us as first time entrepreneurs and people who had never really run businesses before. So now we're 12 people running the business. We'll probably have to hire very soon to grow with our customers and to be able to serve those customers. But that's how the business kind of looks today. We're based in Dublin on Dame Street. That's where our team are. But we also have an office in New York, which I might try to get a photo of for Elaine to show you guys. Um, it's pretty nice. It's in Brooklyn. It looks out over Manhattan, so we get to see One World Trade and all of the really tall buildings there, and the helicopters flying in and out of Manhattan. So that's pretty cool. But sounds cool, but we're basically never there because anytime we're in the US, we're pretty much selling to insurance companies, and they tend to be in the back and beyond, in the middle of nowhere, because insurance companies, even though they're very big, most of them don't make very much money in the dental area. So they're trying to save costs, and they're always in the middle of nowhere. One of them is in an area where the biggest attraction is the Hershey's factory that makes chocolate in the US. Another one is kind of famous because they have all these big crosses lining the road, but that's the biggest tourist attraction in the area. So it's really not that glamorous when you're in the US. We're doing a lot of traveling and really just trying to get people to come on board and contract with us. So uh, the New York office sounds very exciting, but unfortunately, like I said, we don't spend a lot of time there. I guess other things that might interest you guys in terms of running your own business. Um, like I said, when I started out and when the rest of the team started out, except for my dad, nobody had ever run a business before. We were all just fresh out of college. So while it's very exciting to start something new, you don't always know what you're doing. So you're kind of always looking to others for advice and experience. And sometimes you're just doing things on a gut feeling. And lots of times you try things and they won't work. But that's very exciting. It's very enjoyable to be able to control the work you do on a daily basis. So we used to kind of plan everything daily or weekly, and then we came across a system called objectives and key results, which is used by Google, it's used by Twitter, it's used by Bono, it's used by tons of people to basically plan their work around their goals. And when we brought in this system, it allowed us as first time managers and first time business people to really see where we're going and be very clear on what we're trying to do, and also to be very clear on what we're not trying to do, because that's something we learned is a big it's a big problem when you're faced with opportunities all the time, that you have to be clear on what you're not doing. So people asked us to open up in Dubai, and we said, well, actually, we're really focused on the US, so we can't split our attention. I'm trying to think if there's any other kind of funny stories. We used to be called Oral Eye, which is not a great name because nobody knows what it means really or how to spell it. So very quickly, when we could and when we could afford it, we rebranded and renamed to Toothpic, um, which hopefully is a little bit clearer. Um, Trying to think if there's anything else exciting. I guess back to the that idea of like what it's like running your own business. And I'm sorry you guys can't ask questions. It's a pity. I'd love to answer any questions you have, but other than making the decisions, I suppose sometimes that's a positive and sometimes it's a negative, because there's a lot of responsibility when you're employing other people. Many of them are our friends, so we feel like weight on us to I suppose make good decisions on their behalf and on our behalf and on the behalf of our investors who gave us their money and they trusted us now with millions of euros to I suppose build a successful business and give them a return, and also reach the patients that we want to reach to give them the access to the care that they need. So there's a lot of I suppose a lot of responsibilities. Um, Paying wages at the end of the month is always a bit of a challenge. In particular, now when we had our investment, it was great, but sometimes when the money is running low, you're wondering where's that going to come from, and sometimes we have to dip into our own savings, or for example, not pay ourselves wages. And a lot of small business owners would be familiar with that. In a month, for example, where they're not making enough revenue or enough profit to pay wages. I know that's a big stress for business owners and entrepreneurs. One of the upsides is obviously you can build things your own way. You can decide on what things are important, and you can choose the way to do it. So that's very exciting, and it keeps you very engaged, I suppose, at work. But the background to that is there's lots of uncertainty. So you never really know. You never have all the information. Your customers don't tell you everything. You don't know where things are going necessarily. You don't know which employees are going to leave. You don't know if people are going to join your company. So there's a lot of unknowns, and really, for people who are comfortable with that, it's okay. But for people who really want certainty, they want to know what they're doing every day. They want to know where their job is going to be in 6 months' time. Um, Certainly, our company it would not be a great place for people like that. Um, I suppose one of the other challenges is you're putting your own money at risk. When you work in an established business that's maybe profitable and has been around for a long time, or a small business where somebody else is employing you, usually you're not putting your own money at risk. You're going to get paid, usually provided the economy is stable and the business is stable. You're going to get paid every week or every month, and you don't really have to worry about where does that money come from. You just have to do your job, and you get paid for that. So when you're a business owner, because you started it or because you bought it, you have these, I suppose, additional concerns. But the upside, or the positive for that, is if the business does well, you share in the value of that. You share in the profits. You If your company is very profitable, you can take money out of it, either in dividends or in profit shares, or in wages. Or in some businesses, like in a company like ours, which is venture backed, so we've taken our money from venture capitalists who want to make profit. They want to make a return, so they invested millions of euros in us, and they want to make tens of millions of euro in return. Uh, the way that companies like us would typically capture the money and capture the value is by selling to a bigger company or selling to a bigger investor in the future. So that's, I suppose, the difference between working for somebody else who's going to pay you, and working for yourself, who you have to figure out for when you have to figure out where you're going to get paid, where the money's going to come from. I suppose one of the other positives about building your own business is that you can decide on who you work with. So you can really choose the people you want to work with. Sometimes it works out well, sometimes it doesn't, but at least you get to make that choice. You have that control. So you have a lot more control typically in your own business than you would if you're working in someone else's business. You can work with people you like, and you can also design a culture that you believe in. So you can. It's not like working for someone you don't like. It's not like working in a company that you don't believe in what they do, or you don't like the effects that they have on the world. You can really, if you're lucky, you can design a company that has an impact on the world that you want to have. And that could be in a private company, a profit making company like ours, or a non-profit or a charity that you could work on as well. So I suppose they're the most of the positives. The big obviously the big challenge and big drawdown the is the cost of doing something like this. So if you're going to employ a lot of people, if you're going to try and have a global impact, if you're going to try and have a fast growing company in a short space of time, it's going to cost a lot of money, and so you need to have access to capital. If you're going to raise money either from banks or from investors, it really helps to have those relationships, or to be able to build those relationships um, with people who can finance the business. So I suppose there's some of the challenges of building your own company, or running your own company. Um, I guess as I think about the future for Toothpick and for our team, um, one of the things I would think about again in my next company and in the next phase of Toothpick is really focusing on those sales, and really thinking about upfront whether you want to have a profitable business, or whether you want to have, as we described, a venture-backed business. So venture-backed businesses where you take money from venture capitalists, you might read about in the news a lot. Like I said, they're not really focused on profit in the short term. They're focused on growth and getting as big as they can, as fast as they can. So I would really think about what type of business I wanted to build. In our case, we just wanted to start a company. We didn't really know anything about this, and we didn't know the difference between a profit kind of focused company and a growth focused company. But that's something I would focus on more if I was building another company, or really in the next phase of Toothpick. We really need to get that clear around growth versus profit. And then also bringing in more experienced people. So we haven't done this before. We know that. We know we need to get experience from somewhere. So we can either wait to learn it ourselves, or we can bring in experienced people. We did try this already. We brought in a chief marketing officer, a guy who had run a business. He employed 18 people just in marketing. to grow a telemedicine company that did video calls with doctors in the UK. We brought him in to work with us, and really we were probably too early. We weren't ready. Our product wasn't kind of ready for the market enough for him. So he ended up moving on. But I still think overall bringing in those experienced people is something we would need to focus on more in the future. It's something we didn't do at the start, but at the next phase we will need to do that. So that's a very kind of high level overview, guys, of how I started out, how we started the company, what we went through in order to get it set up, and how the product evolved a little bit. Today, it's still very similar to that first time I took a photo of my teeth and gums and sent it to my dad. The app is called Toothpic. If you guys want to see more about it, you can download it on iOS or Android. If Elaine wants, or if you guys want, feel free to send questions through Elaine to me. I'm very happy to answer them. And if anybody wants feedback on their own businesses, if you do decide to do something in the future, don't hesitate to let me know. Like I said, sorry I couldn't be there in person, but it was great to have this opportunity to chat to you in one direction, and maybe we'll chat again in the future. Maybe I'll get a chance to come into your class at some stage. All right, best of luck with the future at the exams, guys, and if you start your own businesses, best of luck with those. Bye.